Hi, my name is Amy Whitmore in R224. This is Trach Care, Chamberlain University, New Orleans campus. My D number is D411-05325. Good morning, Mr. Wayne. My name is Amy. I'll be your nurse today. I'm going to do a little trach care on you, suctioning if need be. But first, before we get started, I need to verify your name and date of birth. Let me check your armband, please. Okay, can you state your full name? Mr. Bruce Wayne, and your date of birth, please. 2/1963. Excellent, thank you. Okay, and before we get started, let me verify, or do you have any allergies? You are allergic to sulfa drugs. I do see that right here. And are you in any pain at this time? On a scale of 0 to 10. 0, excellent. Okay, so what we're going to do is going to take about 20 minutes. I'm going to suction, and then I'm going to do a little trach care on you. But first, before we do all that, I'm going to close your curtain for a little bit of privacy. And we are going to raise up your bed to hip level. That's for me, not you. You know, save my back a little bit. And now I'm going to perform a little bit of hygiene. So I'm also going to place you in a high Fowler's position. That is to make it easiest for me to do everything that I need to do. All right, so I'm going to adjust my camera here a little bit so everybody can see what I'm doing. Now, what I'm going to do is I am going to don on my PPE. I'm going to put on my gown, my mask, my eyewear if need be, and I'm also going to, but before I do that, I want to listen to your lung sounds. So I'm listening to your lung sounds. I hear that they are a bit adventitious, so we are going to definitely need to do some trach care on you. And let's see, let's check your SpO2 is about at 93%. Now, I'm going to go ahead and cover my patient with a drape. That way I keep everything from being a little messy. And I am going to open my kit here away from me. There we go. Get that done. This is a sterile procedure. Now, what I need is I'm also going to open up my sterile saline so I can get to it. Let's get the box out. I'm going to pour a little bit of saline into my box, and now I'm going to go ahead and get my sterile gloves on. So, now once I get my sterile gloves on, I am going to stay within 2 inches of my area to continue to make this a sterile procedure. Discard of this properly in the proper receptacle. Alright, so this here. What I'm going to do is I am going to coil this a little bit in my dominant hand. And with my non-dominant hand, I am going to turn on the suction regulator, or the suction device. I'm going to adjust the regulator to about 120, and I am going to turn on the suction regulator. Now, before I did all of this, I did increase Mr. Wayne's oxygen level up to about 15 liters. I wanted to hyperoxygenate him just a little bit before we got started. So, Mr. Wayne, what I'm going to do now is I am going to insert the tip of the suction into the basin of the saline. And what this does is this allows it to flush and moisten the tubing. It makes it easier for insertion. Okay, so let me go ahead and do that. All right, we've got good suction going on. Okay, Mr. Wayne, I'm going to start suctioning. Are you ready? All right, so with my non-dominant hand, I am removing the trach mask, and with the dominant hand, I am going to insert suction until I feel resistance or the patient coughs. I'm keeping this open. Now, I'm going to close down my suction chimney. I'm going to gently rotate while withdrawing the catheter. I'm not going to take any longer than about 10 to 15 seconds. Okay. All right, so Mr. Wayne, let me have a quick look at everything. All right, let's see. Your SpO2 looks about 94%, so we are going up, but we still would like to come up a little bit more. Your skin color is slightly flushed around your face, but otherwise is normal and appropriate for your ethnicity. All right, so I also needed to reapply your trach mask while I am reassessing everything. So what we're going to do now is we're going to rinse the tubing and the sterile saline. So we're going to get a little suction, make sure we rinsed it out, and then we put it in the bad stuff in the proper receptacle. All right, so Mr. Wayne, I'm going to suction you again. Are you ready? Excellent. Okay, so with my non-dominant hand, I'm going to remove the trach mask again. I'm going to insert once again until I either meet resistance or Mr. Wayne coughs. Pull out about a ½ inch. So I didn't verbalize that last time. Then I'm going to close my suction. Now I'm going to gently rotate as I remove the suction catheter. Not going to be in there any longer than 10 to 15 seconds, so I have done that. Let's put Mr. Wayne's trach mask back on. All right, let's reassess vitals one more time. I do see everything has come up nicely. It looks like his SpO2 is now 96%, and his respirations appear to be within normal limit, because that doesn't exist. It appears to be about 20, and what I'm going to do now is we're going to disconnect the suction cath from the tubing. We're going to turn off the regulator. Let's discard our cath and supplies in the bio box. Let's remove, let's remove the drape and discard it in the proper receptacle. And then we're also going to remove sterile gloves. I no longer need to be sterile for this part. And I'm going to perform some hand hygiene, and I'm going to pause a second to get reset for Trach Care. Okay, I am now ready to perform my Trach Care. Okay, Mr. Wayne, we are going to do a little Trach Care on you right now that we've gotten you good in suction. So what I need to do is I am going to open my Trach Care kit from me. And I am going to take my nitrile gloves. So take my nitrile gloves, well, my sterile gloves, and I'm only going to don my non-dominant hand. No, I'm going to do it with my dominant hand. So now I am with my non-dominant hand. I'm going to take my sterile saline. Let's see. Let's take this drape out right here. I'm going to pour a little bit of saline in here. Let's see, we can adjust this a little bit. You can see better. Okay. See Mr. Wayne a little bit better. There we go. Okay, so I am going to, alright, so I put my sterile saline in, and I'm going to so I'm going to use, because this is all sterile, take this out, we don't need this. So now I'm going to take my cotton tip and put it in the sterile saline. Also going to put a little bit of gauze in there as well. So I've got my gauze and my cotton tip applicator in it. Yes, that's what I need in there. So now I'm going to get sterile on my non-dominant hand. All right, Mr. Wayne, I'm ready to clean your trach. Is that okay? All right. Okay, so now I'm going to remove the trach mask. We're going to unlock your inner cannula, and we're going to remove the inner cannula. Okay, so we did that, and we're going to throw it in the proper receptacle. Now, following the direction of the curvature. Oh, okay. So I'm going to take my new cannula, and I am going to insert a new inner cannula in here. We're going to follow the direction of the curvature, and we're going to secure it by turning it in the locked position and secure it. Now, I'm going to take my cotton tip applicator, and we are going to clean out your cannula and your trach site using a circular motion from the stoma site outward. Here you go, Mr. Wayne. Are you doing okay? Great. So now I am going to discard this in the appropriate receptacle. Now I am going to take my moisten gauze. I'm going to gently clean your outer cannula, your stoma site, all this good stuff. Right, then we're gonna, so with my non-dominant hand, I am going to stabilize get all my stuff together. I did drape Mr. Wayne, by the way. I did put a drape on him prior to getting started. So, all right, so we're going to, with my non-dominant hand, I am going to stabilize the trach tube, and then with my dominant hand, I am going to replace the trach ties. I'm going to put 2 fingers under to make sure that there is enough room, and I'm going to keep the old ties in place until the new ties are secure. Tie them in a square knot, and remove after I get everything secure here, I'm going to remove the old ties and discard them in the proper receptacle. Now, what I need to do is discard all of my supplies, my PPE, I no longer need it, my gloves, my gown, everything is going to be discarded now. I am going to put Mr. Wayne's mask back on. I'm going to turn his oxygen level back down to what he was prior to me entering, to the normal oxygen level. And now I'm going to reassess all of my vitals. I'm going to auscultate his lung sounds. They sound clear and equal bilaterally. His SpO2 is looking about 96% on his oxygen, where that's acceptable. His respirations are about 20, and all of his other vitals appear to be normal for him. So what I need to do now is I'm going to lower the bed back down all the way to the floor. Mr. Wayne, I'm going to adjust you up a little bit. Just tell me where you want me to put you. All right, that's a great position for you. The bed is locked. Let's put your call light next to you, so if you need anything, you can call me. Is there anything else I can do for you today, Mr. Wayne? Excellent, thank you. I do appreciate it. And let me just check one more time. Are you in any pain right now? Okay, excellent, thank you. 0 out of 10. Okay, I'm going to do hand hygiene one more time. I am going to check on you in a bit, Mr. Wayne. Before I leave the room, I'm just going to do a little documentation. So what I've documented is that I did vitals before my procedure started. I assessed them in between doing this suctioning. I assessed them again after I did the suctioning. I also noted any secretions that came out. I noticed the color and consistency of them. I noted the lung sounds that I heard both before, during, and after. And I have also documented the type of procedure I did, which was a sterile procedure. I noted that there was something else I needed to know. Oh, the type of Trach Care that I did, that I removed everything, I cleaned it appropriately, and that I replaced it with new stuff, discarded everything properly, and I think that I have done everything I did. Let's do hand hygiene one more time because it's fun. Thank you, Mr. Wayne. You have a wonderful afternoon.